Good day. I am Vincent O, and here with me are Early John Q. Regino, Marvin P. De Guzman, Jire Ashley Kimio, Lawrence Carl Ratak, and Elisha Escala. We are here to present our case who's a first-time mother with undiagnosed Bernard-Soulier syndrome.
26 years old Filipina, Gravida 1 Para 0, is overdue from her supposed delivery. The patient is now 41 weeks pregnant, and because of this, the obstetrician gynecologist decided to perform a cesarean section. The physician ordered a complete blood count test to check if there is a lack of red blood cells, while clotting time was ordered to assess the functionality of the patient's clotting factors and platelets. The clotting time was 7 minutes, which is normal. The CBC report revealed a normal RBC count and normal WBC count. However, the platelet estimation results showed 53,000 platelets per microliter, which indicates thrombocytopenia. Another platelet count was done and revealed 47,000 platelets per microliter. The patient's blood was viewed by a microscopic examination, wherein giant and irregularly shaped platelets were seen. The patient was interviewed and it was found out that the patient experienced frequent nose bleeding while sneezing and gum bleeding while brushing her teeth. Other tests were done. APTT and PTT revealed as normal, which were 32.4 seconds and 11.6 seconds respectively. On the other hand, the ristocetin-induced platelet aggregation test confirmed that the patient has Bernard-Soulier syndrome. A normal amniotic fluid index of 16.3 cm was identified, but due to complications, the patient had to be administered bags of platelets for 3 days. A healthy baby girl was delivered with a weight of 3.525 kilograms.
Based on the case scenario, the following tests were ordered. Complete blood count. The principle of this test is to count and analyze different types of blood cells present in the sample. In this case, the purpose of this test was to check for potential abnormalities such as low RBC count indicating anemia, high WBC count indicating infection or inflammation, and abnormal platelet count. In this case, it was ordered to assess the patient's overall blood cell profile and detect any abnormalities that could contribute to the bleeding symptoms. Clotting time. The principle of this test is to add a clotting initiator to the blood sample and measure the time it takes for a clot to form. In this case, the purpose of ordering this test was to ensure the patient's blood clotting ability is normal and not prolonged, as excessive bleeding during or after surgery could occur. Platelet estimation. The principle of this test involves counting the platelets present in the specific volume of blood under a microscope or using automated methods. In this case, the purpose of ordering platelet estimation was to assess the patient's platelet count. Prothrombin time. This test is to evaluate the extrinsic pathway of the clotting cascade. In this test, a reagent containing tissue factor and calcium is added to the patient's blood sample. The time it takes for the blood to clot is measured. The PT test checks the functionality of factor 7 that is involved in the extrinsic pathway. In this case, the test is being performed to determine if the patient's clotting factors in this pathway are working properly and to rule out other possible causes of thrombocytopenia. Activated partial thromboplastin time. The principle of this test is to evaluate the intrinsic pathway of the clotting cascade. In this test, a partial thromboplastin reagent and calcium are added to the patient's blood sample. The time it takes for the blood to clot is measured. This test assesses the functionality of clotting factors such as factor 12, 11, 9, and 8, which are involved in the intrinsic pathway. The purpose of performing the APTT test in this case was to check the functionality of the patient's clotting factors in this pathway and to rule out other causes of thrombocytopenia. Ristocetin-induced platelet aggregation test. The principle of this test involves adding ristocetin to the blood sample and measuring the level of platelet aggregation. In this case, the test was conducted to confirm the diagnosis of Bernard-Soulier syndrome, an inherited bleeding disorder characterized by the absence of GP1B. Amniotic fluid index. The principle of this measurement involves performing ultrasound to measure the deepest vertical pocket of amniotic fluid in 4 quadrants of the uterus and summing these measurements. In this case, it was done to assess the fetal well-being.
Here is a summary of the test result values and interpretations from the tests ordered. Complete blood count, platelet count 47,000 platelets per microliter, hemoglobin 14.3 grams per deciliter, hematocrit 35%. This interprets to abnormally low, normal, and normal respectively. Platelet estimation 53,000 platelets per microliter, abnormally low. Activated clotting time is 7 minutes, prothrombin time is 11.6 seconds, and activated partial thromboplastin time or APTT is 32.4 seconds, all three of which are normal. Meanwhile, the result for ristocetin-induced platelet aggregation tests is absent, which interprets to hypoactive agglutination, indicative or suggestive of Bernard-Soulier syndrome. Finally, amniotic fluid index is 16.3 centimeters, which is normal.
Bernard-Soulier is a rare congenital bleeding disorder of the platelet. It is inherited and causes qualitative and quantitative deficiencies of the platelet adhesion. Here are some symptoms of Bernard-Soulier syndrome. Easy bruising that takes longer to heal than usual. Excessive bleeding that even minor cuts to the people with this syndrome bleeds excessively, even if it's just minor cuts or injuries. And lastly, frequent nose bleeding is experienced by patients or people with this syndrome. Also, bleeding under their skin called petechiae because their vessels are fragile. And female patients with this syndrome experience heavy menstrual bleeding.
Bernard-Soulier syndrome is unpredictable in childbirth. It may lead to no complication in delivery to fatal morbidity due to excessive bleeding. The peripartum period is the most crucial stage in the pregnancy for women with Bernard-Soulier syndrome. A platelet transfusion was ordered because the patient has a low number of platelets, which will be used during the C-section due to a huge cut on the belly area. C-section was also necessary because the patient was overdue to their supposed delivery. According to Pietsides et al. 2010, primary postpartum hemorrhage is seen in 10 cases of women with Bernard-Soulier, and secondary postpartum hemorrhage is seen in 12 cases with women with Bernard-Soulier syndrome. Thus, blood transfusion has been ordered to mothers during delivery. Autoimmune thrombocytopenia was also seen in neonates. Neonatal autoimmune thrombocytopenia is caused by maternal antibodies raised against alloantigens that were carried on fetal platelets. It is the leading cause of severe thrombocytopenia among neonates, and intracranial hemorrhage occurs in 10 to 20% of symptomatic infants, which indicate a serious complication of an AIT.
Following the completion of lab tests, some significant results that aid in the identification of patient disorder are CBC, which reveals that the patient has abnormally low platelet count, and prothrombin time, which was slightly increased, indicating that the patient has thrombocythemia. The patient had also experienced several episodes of nose bleeding while sneezing, as well as gum bleeding while brushing her teeth. With this information, this indicates that the patient is suffering from Bernard-Soulier syndrome, which she was diagnosed with decades ago. Furthermore, the patient has a significant decrease in Rosertin-induced platelet aggregation, which was a confirmatory test for Bernard-Soulier syndrome. The obstetrician decided to perform a cesarean section due to the patient being overdue. Amniotic fluid index is in normal range. However, due to the patient condition, bags of platelets were administered for 3 days to manage the bleeding and maintain the normal blood clotting process. But despite the complication, a healthy baby girl was born. As a medical practitioner, it is critical to understand the constituents that contribute to the patient health, since these aspects are important in determining any underlying disease that the patient may have. As a medical technologist, we have the advantage in performing lab tests that aids in the diagnosing what disease is present. We may not be allowed to express our diagnosis in the patient case, but the information we gathered has played a significant role in saving people's life. We simply leave you with this quote: "Not all heroes wear capes. Others are in hospital behind the lab gowns performing tests to save people."
Here are the references that help us with our case presentation. Thank you for listening.